Peter Lamb.
Thank you, Madam Deputy Speaker. I am very grateful to be called as part of the budget debate, particularly on this section about the UK's most beloved national institution. The NHS may well be well loved, but unfortunately it has not been well cared for over the last 14 years. And don't we all know it? Our inboxes are filled with people crying out for our support to get the treatment that they desperately need. All of the data shows the problems. In my own area, we have people waiting in A&E for over 4 hours at over 4 times the national target rate for the NHS. And in terms of elective operations cancelled at the last minute, back in the first quarter of 2010, when the last Labour government was in, that number in my area was just 75 cases. It's now at 520. I think we can see the scale of the problem we face. And we know it from our own personal experiences that whenever we come into contact with the NHS, that NHS workers bend over backwards, often in their overtime, to try and make things work for us. But mistakes and delays are inevitable in a system which has been systematically under-resourced. Madam Deputy Speaker, NHS workers need a government that is on their side, and in this budget we are doing exactly that, delivering the £22.6 billion increase in NHS funding, the 40,000 new elective appointments per week, and the new surgical hubs and scanners, which are going to get on with the job of clearing the Conservatives' backlog. And just on that point, some of the comments which have been made by members opposite I found deeply surprising in the course of this debate. I think best summed up by the Honourable Member for Tonbridge, that he wrings his hands for the millionaire families, but was perfectly happy seeing child poverty in the UK grow to over 1/3. That they talk of debt, plunging people into debt. Well, they racked up £2.6 trillion worth of debt, 3 times what they inherited from the Labour government. They talk about levels of tax on businesses, while at the same time ignoring that working people in the UK have never been more highly taxed than under the last government. They talk about businesses and being on the side of them, but ignore that it was the Prime Minister that they put into office who had a very rude 4-letter word to say what he thought about businesses in this country. I think the one thing we can all rally round on in terms of NHS investment is that it is desperately needed for the research into the collective amnesia of the members of the benches opposite. I would be remiss if I didn't say, while the Chief Secretary to the Treasury is here, that Crawley could really do with a brand new acute hospital if they're being dished out. But as this government isn't one which tends to promise hospitals and then not put any funding aside to deliver them, I'll leave that debate for the future. What is needed today, however, is for the services that we do have to be delivering for patients once more. The Darzi report has shown us the way forward, and this budget puts us back on course for delivering that world-class cradle-to-grave health service that past Labour members gave to the country in the 1940s, the Labour members rescued in the 1990s, that members here today will save again in the 2020s. And if the members opposite wish to save that service, they are perfectly happy to join us in the division lobbies later in this week.
I call